Hello everyone, this is Dr. Seaton with the Chiropractic Place. Today's video is about this phrase that I've heard quite a bit from patients when they have questions about first starting with chiropractic care. And that is, once you see a chiropractor, you have to keep going. Doc, I've heard from my friends or I heard from a coworker that once you start seeing a chiropractor, you have to keep going. The short answer to this is no, you don't have to keep going. Everybody in our office is allowed to make a choice about what they do with their health. Some people choose to come into the chiropractor maybe once or twice or three times if they're suffering with some kind of a flare-up in the, neck pain, headaches, low back pain, whatever it may be. And after their flare-up subsides with chiropractic care, they choose to not come back until there's another flare-up. That's totally fine. People are allowed to make choices in our office about their health. Now, we have some patients, a lot of patients actually, who come under chiropractic care. Perhaps they had some kind of a flare-up going on, and they start to see the improvements in their pain. But they also start noticing improvements in their overall health and well-being. They're sleeping better, they have a better mood, they are able to have better range of motion, they have less pain, they have better overall quality of life. Those patients typically ask me the question, hey doc, I'm feeling really good. I don't want to go back to living how I was living. How often should I come in to maintain this? And typically with patients, that could be anywhere from a couple times a month to once a week. It could be somebody coming in only once a month, once every 2 months. Everybody is a little bit different. But what the question is that they're asking is, what kind of preventative maintenance can I do with chiropractic care to prevent going back to living with crazy flare-ups and having to take a bunch of over-the-counter medication to manage it in many cases? So that's a valid question for patients. Now, not everybody does that, but a lot of patients do. I myself, I use chiropractic in the preventative maintenance way. I have my spine checked at least once a week by my colleagues to make sure that I'm functioning at my very best. Now, this question here, it's a fair question. You can choose to only come in when you have flare-ups. It's not ideal because it doesn't honor the preventative side of chiropractic, which can help prevent future problems down the road as well. Very similar to why patients brush their teeth twice a day, hopefully, because the dentist is trying to prevent future problems, future cavity issues or gum disease, because they want you to do something proactive regularly. Chiropractors are no different. We like if patients want to utilize this preventatively, but we also, in my office, we don't force people to do what we do. If you want to come in only when you're flared up, that's totally fine. But that question there is related to wanting to prevent future problems. I'm Dr. Seaton with the Chiropractic Place.